Hi everyone, today we're going to talk about the neck and larynx anatomy in this video. First, we're going to start off with the neck and the musculature. This is an anterior view, and our first muscle is the sternocleidomastoid. This actually has two heads, one attaching to the clavicle, one attaching to the manubrium of the sternum, and there's also attachment at the mastoid process, where we'll see on the next slide. It's innervated by the accessory nerve and helps to tilt and rotate the head and neck laterally. Next, we have the sternohyoid muscle. This is attached to the manubrium of the sternum and the hyoid bone, which is up here. This is innervated by part of the cervical plexus and is involved with depression of the hyoid and larynx to help with swallowing and speaking. Finally, on this slide, we have the sternothyroid muscle. This is attached to the manubrium of the sternum and the thyroid cartilage, which we'll talk about later. They're the same innervation and action as the sternohyoid. It is innervated by part of the cervical plexus and it's involved with depression of the hyoid and larynx. Here's a lateral view, and you can see the mastoid process attachment of the sternocleidomastoid. But our next group of muscles will be the scalene muscles. You have your anterior scalene, your middle scalene, and your posterior scalene. All of these are attached to the cervical spine and a rib, the first rib for the anterior middle, and the second rib for the posterior scalene. Generally, these are innervated by the brachial plexus, and they are involved with elevation of the upper ribs, as well as tilt and rotation of the head and neck like the sternocleidomastoid. Next, we have the omohyoid bone. This has two bellies, a superior and inferior belly, attached by the intermediate ligament. It's attached to the hyoid and to the scapula. It's innervated by the cervical plexus and is involved with depression of the hyoid and larynx during swallowing. Finally, we have the posterior digastric. There's also an anterior, which it's attached to, which we'll see on the next slide. This is attached to the hyoid bone and the mastoid process. It's innervated by the facial nerve, and it elevates the hyoid and depresses the mandible. Here we're looking at anterior inferior view of the head, so as if you're looking up at the chin. Here's the mandible for reference. And for our first muscles, we will see the posterior digastric again, as it attaches to the anterior digastric. The anterior digastric attaches to the mandible and the hyoid bone. It is innervated by the mandibular branch of the trigeminal nerve, and it elevates the hyoid and depresses the mandible. Then we have the stylohyoid bone. This is attached to the styloid process of the temporal bone and the hyoid bone. So a lot of these muscles, the names indicate what their attachment points are. This is innervated by the facial nerve, helps to elevate and retract the hyoid, as well as depress the mandible. Finally, we have the mylohyoid bone. This is actually the floor of the mouth. The tongue sits on top of this. Is attached to the mandible and the hyoid bone, and it is part of the mandibular branch of the trigeminal nerve. That's what innervates it. It elevates the tongue and depresses the mandible. Now we're going to move on to the nerves of the neck. Only 4 of them. Here's a hypoglossal nerve right up here, nerve 10. It is somatic motor innervation to the tongue muscles, which is why it's near the mylohyoid bone. Mylohyoid muscle, sorry. Here we have the phrenic nerve. It's kind of hidden by the vagus nerve, but it's back there. And we learned about this earlier, it innervates the diaphragm. Here's the vagus nerve. This is general sensory information to the larynx, as well as motor innervation to the muscle of the pharynx and larynx. And finally, we have the brachial plexus. This doesn't show any of the branches or anything, just basically the start and general location of the brachial plexus. Now to vasculature. This is the arteries of the neck. We have the common carotid artery, which splits off into the external carotid and the internal carotid. Then if we look at the veins, we have one main vein that we're going to talk about, which is the internal jugular vein. There's also an external, but the internal jugular takes a majority of the blood from the head and neck and brings it back down to the heart. And going back to the arteries, we have a thing called the carotid sinus. This is where, from the common carotid artery, there is a split of the external and internal. And inside of this is it's a reflex area and consists of baroreceptors to monitor blood pressure. And this is because of a branch of the glossopharyngeal nerve. When you think about this, you can take your pulse at this area and you can feel your heart rate, but there is danger to this. If you press too hard, you can actually slow down your blood pressure and your heart rate, and it can cause you to pass out. Now we're going to talk about two glands of the neck area. We have the submandibular gland and the thyroid gland. Submandibular gland is innervated by the facial nerve and it produces saliva. You can see it here on the cadaver image. It's a little more on the lateral side of the neck here. And then we have the thyroid gland. It is the largest gland, producing mainly T3 and T4 hormones to regulate metabolism and protein synthesis. It has a butterfly shape, as you can see, which in this image is covered by the muscles. Now we have a clinical case based on some of the information we just talked about. So from the information, a 64-year-old man reports persistent pain and swelling in the right floor of his mouth, like the submandibular region. He has increased swelling and pain when he's eating, and increased pain with sour and acidic foods. He is a smoker, and when the physician palpates around that region that he's experiencing pain and swelling, he prompts for further imaging. So a CT scan is done, and it shows that there is a mass there, and it's decided that the diagnosis is right submandibular gland sialolithiasis, which is basically a salivary stone. These are most common in the submandibular gland, which is why I included this in the video. And it can be treated conservatively with anti-inflammatories and by staying hydrated, because that is one cause of this, is being dehydrated. And if it's as big as the one in this image, it's most likely going to be surgically removed by cutting into the gland and removing the stone. Now on to the larynx. The larynx basically has protective function of the respiratory pathway, so the trachea, through its hard cartilage in the front. And the first cartilage is the thyroid cartilage. It's pretty big. It's mostly seen on the anterior view. And it also contains where your Adam's apple would be, right about here. Next, we have the cricothyroid cartilage. Sometimes it's seen as cricoid cartilage in images, but this is the only cartilage of the larynx that wraps around the entire trachea. Next, we have the epiglottis, which isn't cartilage, but this is a part of the larynx that helps with when you're eating or when you're breathing. When you are eating, the epiglottis is going to depress to cover the trachea so food can't get into the respiratory pathway. And finally, we have the arytenoid cartilage. This is seen mostly posterior, and it's an attachment point for vocal cords, which we'll talk about next. Here's a superior view as if you're looking down into the larynx, into the trachea. Here's the epiglottis. So here are what we call the vocal folds. They cover the vocal ligaments, and they're basically mucus lines. And the vocal ligaments help create sound and change pitch. When you get them tighter and when they're closer, you're going to have a high-pitched sound. And here are the muscles that help produce sound. There are the lateral cricoarytenoid muscle right here. It's on both sides. Basically above that is the cricothyroid muscle right here. Then you have your transverse arytenoid muscle. This one's hard to see, but if you look at the oblique arytenoid muscle, the transverse is basically a sheath right under it. And you have your posterior cricoarytenoid muscle, which is on both sides. It's a big muscle that spans across here. And then finally, you have your thyrohyoid muscle. This is on the anterior view, and it aids in depressing the hyoid and elevating the larynx during swallowing. Now we're going to look at some cross sections, because for some of this anatomy, it's hard to understand how deep, how superficial it is in the actual body. So this helps understand where like the thyroid gland is, where some of the muscles are, where some of the veins and arteries are. So we'll start with the brachial plexus right here. It's pretty deep near the C6 vertebrae, because this is the start of the brachial plexus. Then you have your vagus nerve here, going to innervate the larynx. Internal jugular vein, your common carotid artery, which will eventually branch off into the external and internal carotids. Your infrahyoid muscles, an example we talked about is the sternohyoid, as it attaches to the sternum and then the hyoid muscle. Your thyroid gland, the biggest gland, the sternocleidomastoid, and the scalenes, which both help tilt and rotate the neck. And if I were to guess, I would assume this is the anterior scalene muscle and this is probably the posterior. And this transverse cross section is at the C6 vertebrae. Next, we're going to look at a sagittal cross section to help understand where the cartilage of the larynx is. To orient ourselves, start with epiglottis, which is the most superior, and you can see how it can close when you are swallowing to cover the trachea. Next, you have your thyroid cartilage, then your cricoid cartilage right here. This is the one that wraps around the entire trachea, and finally, you have your thyroid gland down here. And we're going to end this video with some example questions. So what nerve generally is affected by sialolithiasis, assuming it is occurring at the submandibular gland? This is the clinical case we talked about where he felt pain and swelling in his submandibular region, and sialolithiasis was the salivary gland stone. So trigeminal is incorrect because there is no innervation to any glands. It's mostly sensory to the face and motor to muscles of mastication. Facial is actually the correct answer. It has parasympathetic motor innervation to the lacrimal gland as well as the sublingual and submandibular glands. Accessory is only somatic motor into the sternocleidomastoid and trapezius. Phrenic innervates the diaphragm, and vagus is innervation to the larynx, pharynx. So B is correct. Next question, which cranial nerve affects the carotid sinus and what does the carotid sinus help regulate? So this was part of the common carotid artery. It's where it splits off into external and internal carotids. It contains baroreceptor there, so it's basically a reflex point. So when we're talking about that, would have nothing to do with respiration. It's nothing to do with diaphragm, the lungs, anything. This would have to do with blood pressure. So anything with respiration is out. Next would have to be the nerve. So if we think about the vagus nerve mainly is innervating the larynx, the pharynx, and some of the abdominal organs even. It has nothing to do with blood pressure or anything. So that one's out. So that means A and D are out. Hypoglossal, well, that only has somatic innervation to tongue muscles, so that one's also out. So the answer here is glossopharyngeal and blood pressure. So answer E. Next one, which muscle does not insert onto the hyoid bone? Like I said earlier, a lot of the muscles can be figured out by their names where they attach. So sternohyoid obviously attaches to the hyoid, sternum. Anterior digastric, we'll come back to that one. Omohyoid obviously attaches to the thyroid. Cricothyroid probably doesn't attach to the hyoid because it's attaching to the cricoid cartilage and the thyroid cartilage. And then thyrohyoid attaches to the hyoid. Anterior digastric also attaches to the hyoid. It was the one right under, well, technically on top of the mylohyoid muscle. So D, cricothyroid is correct. Which muscles are involved with head and neck rotation? This is what we talked about in the beginning. So your options are the anterior scalene, the sternocleidomastoid, and the mylohyoid. Mylohyoid I just talked about. It's right under the chin, and it's actually connected to the mandible and the hyoid bone. So that would have nothing to do with rotation of the neck or even the head. Anterior scalene, the scalene group, has attachment points on basically the shoulder area, neck area, and attaches back up to the head. So that would be involved with head and neck rotation, and the same thing with sternocleidomastoid. So the answer here is E. Final question. Laryngitis causes a raspy voice due to inflammation in the throat. Which structure of the larynx is affected? So anything with itis means there's inflammation occurring. Laryngitis means larynx is affected. When we talk about the larynx, we'd have to think about what is causing vocal sounds to be made. So that could be maybe some of the muscles, or is it inside near the trachea? So epiglottis has nothing to do with that. It's about blocking off the trachea when we're swallowing food. Transverse arytenoid muscle, possibly it does help create sound, but more likely it would be that you couldn't create higher pitch sounds, you couldn't move the ligaments as much. Thyroid cartilage, again, that's just protection for the larynx. So the answer here is vocal folds, which do cover the vocal ligaments, which actually produce the sound. And that is the end of this video. Here are the references. Thank you for watching.